We're going to go on time, or we're just going to start?
When you're ready.
Yeah. Okay, thank you all for joining me. Raise your hand if you'd like more energy in life. In fact, raise your hand again if you want an abundance of energy for the rest of your life. In fact, say aye.
Aye.
Imagine, maybe you're feeling flat, you're feeling tired, maybe you're not achieving what you want in your life, maybe you just don't have enough time to spend with your children. Imagine if you had all the energy in your life that you could achieve what you want, when you want, how you want it. Imagine if you had the time to spend with your children, because you're on top of things and you are on top of things as a result of having higher energy. Imagine if you could achieve all your goals in life. So, if you're here and you want to be over here, would you agree that we need a plan or a strategy? In fact, if you agree, please say aye.
Aye.
Before I tell you a little bit about that, I want to just take you back and tell you about a story. But before I take you that story, I'd just like to know, has anybody been lost in their lives? Have you ever felt like you've lost your way in life? Has anybody experienced perhaps a crossroad where things have changed dramatically? In fact, if you have, please say aye.
Aye.
Let me take you back to 1993. I was a budding young footballer. It was a cold morning on a Sunday morning. There was the smell of freshly cut soil, the freshly mown grass, as well as the smell of soil, I should say. It was a very eerie morning. In fact, I just knew something wasn't right. Something in the air did not feel right. I run up the ball for the first time. I run the ball again. I make a couple of tackles. And then finally, I've broken my leg. Help! Help! Get away from me! Jason, what's wrong? What's wrong? Are you okay? I've broken my leg. I've broken my leg. And that's the last I remember. After a series of operations after that, I found myself in a place where I did not know what was next. I thought one moment I was going to be a footballer, next moment this catalyst changed my life. Dr. Ron. Sorry, I go back to see my doctor. I say, Doc, and this guy is a very cold looking guy, very stern look on his face, you know, very judgmental looking. Doc, there's something wrong with me. My leg feels really sore all the time. It's just always aching. It's okay, you'll be fine, there's nothing wrong with you. Now that you've had your operation, you'll be fine. Just walk around like normal. But no, Doc, there's something wrong. Oh, don't bother me with your problems, it's going to be fine. I walked away feeling very disillusioned. I did not know what to do. I went to contact Dr. Ron, my old football doctor. Dr. Ron was a very warm guy, very, very approachable. I went to his office and I said, Doc, there's something not right with my leg. And he looked at me and he said, Jason, something's not right because I feel all this heat in your leg. He sends me off for scans and it turns out that I have a severe infection. Dr. Ron says, Jason, this is quite serious. We might have to operate or we might have to remove your leg. No, that can't be true. What do I have to do? What do I have to do? You're going to have to have a long series of antibiotics, and provided that's successful, you will get on top of this. So I went into depression. I went to drinking. I turned to drugs. I experienced lots of whirlwind of emotions. Lost my career. My leg was almost amputable. And then finally, I go back to Dr. Ron's office and I say to Dr. Ron, I said, so what's the story? And Dr. Ron turns around and says, it's success. We've got on top of this. So thank you so much, Doctor. I've basically had so much gratitude for Dr. Ron that it was incomprehensible. From there though, I experienced a lot of health problems as a result of the drugs. And I basically did not know where to go, so I thought, what do I have to do? I need to learn about myself. I need to learn about my health. And so this is how I'm standing here in front of you today. But let me take you back to the next stage where a major pivotal point came when I undertook some studies. I was speaking to Alison. Alison was this lovely, jolly, friendly principal at my school. And she was very, very helpful. In fact, she had the eye to know who would be good for what in her college. And I remember her saying to me, Jason, I think you'd be a bloody good naturopath. And I turned around and said, Alison, what the hell is a naturopath? I had no idea. I did not know what a naturopath was. She said, I said, aren't those guys, these hippies that live in Byron Bay? And she said, she just laughed. No, Jason, they're very well-rounded practitioners who can help people on many levels. On her advice, I went to study naturopathy. And from not knowing what it was, I became one of the most passionate naturopaths around. So here I am today. I have a system which I believe I'm credible, and I've been through parts of my life that have helped me with this type of system. And I believe that I can help you find where you want to be. So, let me reveal to you the system. The system is basically a system that will re-energise and revitalise your life. But in order to achieve this, we need to uncover the 5 treasures of wellness. Now, the first treasure of wellness is something that without it, you're really not going to have a map. You're not going to have a GPS. You don't know where you're heading. We need to know where we are heading. Without it, perhaps you may get given the wrong intervention. Without it, we simply just don't know what's around the corner. Now, with this first point, we'll be empowered. We will know what action to take. We will know what's in front of us and what measures to take with this intervention. Now, that intervention, is there a camera? That intervention is assessment. So assessment involves really understanding your individuality. We need to understand who we're dealing with in order to apply the right plan. Would you agree? In fact, would you say aye, please?
Aye.
Thank you. Now, my next step, actually, still on the subject of assessment. So, would you agree that if there's something wrong with your car, that it's best that the mechanic does a diagnostic to find out what's going on? Would you also agree that it's best not to commence any plan or any reparative before we have an understanding of the tools we require? So, I believe that assessment is crucial to any healthcare plan. Okay? So we must have the correct assessment. Now, I had a patient. I'll just give you an example about a patient that came to see me some time ago. Her name, I can't reveal, however, we'll call her Mrs. Jones. Mrs. Jones came to me with crucial pain, with excruciating pain, I should say. And she was referred to me as a sciatic patient. Now, if some of you might know, sciatic patient is a sciatic nerve problem, which requires acupuncture or more adjustive therapy or soft tissue treatment. Now, Mrs. Jones knew something wasn't feeling right, so she came to see me. I sent her back to her doctor. Her doctor said, no, it's just sciatic pain, and I insisted that she has a bone scan, because I suspected there was something going on more sinister. It turns out that Mrs. Jones had a bone cancer. Now, think about it. If I were to treat her for sciatica and not got onto this problem, we could be definitely treating the wrong condition and potentially put this woman's life at risk. So that's why I'm so passionate about the right assessment, making sure we know who we're dealing with. So the take-home message is, to not understand yourself is pretty much the same as not understanding life itself. Now, my next point. Without this point, nothing will happen. We must have this point involved in these 5 treasures. In fact, that's the reason why it's up at the top of the list. Without this point, we can't have an outcome with our thoughts in mind. Without this point, we're not in the game. It's like a player who's turned up with his football boots without his jersey. Now, with this particular area, we can use our mind to our best ability and focus on what we want for a positive outcome. With this point, we can keep our mind on the job. So, I believe that the right attitude is crucial for any healthcare plan that you undertake. So the next step, the next letter is attitude. So think about a golfer. I like to use the example of Tiger Woods because he uses a particular technique that I enjoy, that I know about. Imagine if Tiger Woods' mind was not on the job. Now, Tiger Woods has thousands and thousands of people that watch him play golf. His objective is to get the ball from here to over there. Now, just like anything we want to do, if we want to go from here to over there, we need to have a focus. Now, Tiger Woods has this really good breathing technique that pretty much switches him off to all stresses and allows him to focus on his goal of putting the ball in the hole. So off he goes, and you'll have cameras going off, and he still makes the shot. So would you agree that mind is very powerful? In fact, if you do agree, please say aye.
Aye.
So the take-home message that I'd like to leave you with, and maybe write this one down, is that one only heals when sense of self is recognised. Just think about that for a second. One only heals when sense of self is recognised. You make the right choices once you have that understanding. So to finish off, I want to ask you a question. What's stopping you from really being where you want to be in your life? Are you not well? Are you making the wrong choices? How is your health? Do you need to revitalise and energise your life so you can achieve what you want? Thank you very much.
Well done. Thank you.
Got a few things.
Okay.
I've been told I forgot to smile.
Please stay next. Okay. So even though Tosin actually put you in there, you find that very difficult, don't you?
Well, I think it's a manly thing because my hips tend to want to splay out because I've got a bit of a lateral rotation of my hips. It sort of makes me want to do this, so I find it very hard to get in that position.
Okay, so
it's a structural thing.
This is something that you need to practice and perhaps not make it to a point where it's comfortable for you.
So that's comfortable, but this is definitely not.
Okay. Okay. So that where you're comfortable is better than being where you're not comfortable. So as far as you can. And just gently. Just like, oh my God, I'm scared to death. How am I going to get through this? So even if you're quaking in your boots, it makes you look much more relaxed. Okay? And you did my favourite. That's quite distracting.
All right.
So just try, when you're not actually using your hands as in one of the gestures,